Thank you, Dr. Tawil, for inviting me to present this topic on dental links. It's always a pleasure to share my experience with guided surgery using Implant Studio planning software and producing surgical guides to perform this kind of surgeries. Let's start with a short introduction on digital dentistry. Digital dentistry refers to the use of dental technologies to carry out dental procedures rather than using mechanical and electrical tools. Why we use digital dentistry? To improve the treatment, to have a better accuracy and precision, and a high level of predictability of what we're waiting of our treatments. When we say digital dentistry, we have to speak about three pillars: CAI, CAD, and CAM. CAI is data acquisition using an intraoral scan, or if not available chairside, we can use a desktop scanner. CAD is software for designing and planning, and CAM is milling, printing or melting to generate and produce the future restoration. 3D technology has drastically changed dentistry, and in 2020, which means this year, 80% of all restoration will be delivered using milling machine, chairside or in the laboratory. Let's focus on guided surgery using Implant Studio software. When we say guided surgery, it will be most accurate way for implant placement. The implants will be placed prosthetically driven. We have an optimal prosthesis which can be screw retained, and what's very important is to prevent damage to vital structures. To do guided surgery, we need first DICOM files, cone beam computed tomography. We need digital scans or surface scans that can be used or delivered by an intraoral scan, if not available, a desktop scan. We need implant planning software, and here we'll use Implant Studio by 3Shape. We need a designing software to design the future restoration. We need a 3D printer to produce the surgical guide, and a milling machine to generate the temporary or permanent restoration. Once the surgical guide is ready, we need a guided surgical kit to perform this guided surgery. I will show you some cases to make this approach easier. We will start by a single implant, multiple implants for partial and full edentulous. Let's start with a simple case, a single implant. This is a case where we need to extract the second lower premolar, place immediately an implant, and restore it by a temporary crown. So, as I said, we start by the surface scan. In this case, we had the surface scan by Trios 3, so it's available chairside. In case it's not available, you can take a conventional impression, send it to a lab that has a desktop scanner, digitizes to have a surface scan. Once we have a surface scan, we need a DICOM file. I will show you a small video how we do the planning. This is a surface scan. We need to import CT scan, which means DICOM files. This is a DICOM file. Then we have to design a virtual crown that will guide the implant placement. You can check the bite. Then we need to load the CBCT or DICOM files, crop it, then we go to the next step, that will be the alignment. After defining the panoramic curve, this is how we define the panoramic curve, and this is a matching between two scans, surface scan or DCM files and DICOM files. You can check here that the matching is perfect, then you confirm. Because it's lower implant planning, we need to define and draw the mental nerve and the mandible nerve. And this is the planning, prosthetically driven. You can check and you can see that the implant is placed completely prosthetically driven. You choose the implant brand. In this case, we placed a BLT rock solid implant by Straumann. This is how you can change the axis of the implant. Then we draw the surgical guide. And this is the final surgical guide. We need to add some bars to have a better rigidity and strength. Viewing windows to check if the surgical guide fits perfectly. You can add ID. And then I will do a small overview after the video. So we start by choosing the indication. We remove the tooth virtually. Then we design a temporary crown that will guide the implant placement. And you can check the implant placed. And then we design the surgical guide. And this is the STL file with the drilling protocol, and then we send it to a printer to generate the surgical guide. You can see the surgical guide with the sleeve, and we design immediately the temporary crowns that will be milled and bonded on a vario base. So let's start by the surgery. First we need to extract the tooth. Then it's very important to check if the surgical guide fits perfectly. Then we go by performing the drill to fulfill completely the drilling protocol. First drill, the pilot drill, the second drill, taper, the third drill, red taper, 3.5, and then we placed completely guided the implant. And this is the patient that will leave immediately with the temporary crown screw retained, and you can see the x-ray of the implant with the vario base. This is the x-ray after 3 months waiting for the healing. We remove the temporary crown and then we take a scan to design the future restoration. We start by emergence profile, scan body, antagonist, bite registration, and choosing or measuring the shade. Sent to a special software. We design the crown, and this is a full monolithic zirconia crown that was colored with a color infiltration and stained, and this is a vario base. And you can see what's very important, the access hole is in the middle of the crown because the surgery was guided surgery, which means the implant was prosthetically driven, and you can see the result of the tissue, the healing of the tissue, and this is the x-ray, and this is the case 2017, and then x-ray after 2 years, and you can see the bone growth on top of the vario base. This is the photo before in 2017 and 2019. Let's go for another case where we will perform a pilot guided, not a fully guided, which means it will help you to see the access and the insertion of the implant. 2 missing laterals. After an orthodontic treatment, we decided to place 2 implants. You can see that the space is not very wide, so what we decide, and you can see there is a small concavity. Because of this, we decided to do it guided. So as we said before, we need a software for planning, the Implant Studio. We need a surface scan. We need a CBCT. We have to match and then place the implants, prosthetically driven, and then we design the surgical guide. And this is a surgical guide for pilot guided surgery. It's only 1 drill, and this file will be sent to the lab, and we will receive the surgical guide printed with a drilling protocol. This is a surgical guide. We have to try it as usual to check the fit. It's very important to have a perfect fit, to have the same planning and placement as planned on the software. This is a surgical guide. We have to add the sleeves. Then we raise a flap because it's pilot guided, not a fully guided. Then we can see the implants placed. In this case, we use 2 BLT SC small crossfit 2.9 12mm implants by Straumann. Let's show another case with a distal indentation, 2 molars missing. We decided to place 2 tissue level implants in this case. As we said, we need to start always by a surface scan. If not available, you can take a conventional impression with any material, have a model, plaster model, then use a desktop scanner to digitize it. Then we need the software for planning by 3Shape, Implant Studio. Step by step, we start by designing virtual crowns that will guide the implant placement. CBCT, as said before, panoramic curve. What's very important is crucial is the perfect matching between the surface scan and DICOM files. Then implant placed, virtually, prosthetically driven. This is the surgical guide, STL file that will be sent to the lab, and we can have the surgical report with the drilling protocol. The lab will print it, and you can see the surgical guide with the sleeves. As said before, mentioned before, it's very important to check the fitting. Punching, we remove the surgical guide, we remove the punch tissue, then placing the implant, and you can see the axis of the implants. Parallel, as planned, placing healing abutments, and this is the x-rays of 2 RN implants, 4.8, 6mm. Let's finish this presentation by an advanced case for full edentulous maxilla. In this case, to do guided surgery for edentulous arch, we need to have two CBCTs, what we call a dual scan protocol. Which means, let's make it easier. We have to scan the denture of the patient with 5 radio-opaque markers extraorally, and then place it intraorally and rescan it. 2 CT scans or 2 CBCT. In case the patient doesn't have any removable, you need to prepare a new complete denture to perform this procedure. In this case, the patient had an old complete denture. It wasn't perfect, so what we decided to reline it to have it perfectly stable. Then we placed 5 radio-opaque markers on a buccal surface of this complete denture. You can see that we used gutta-perca. Then this is the planning. I will show you briefly a video how to plan and how to do the dual scan protocol. So this is the CBCT of the complete denture, and you can see here the complete denture was placed intraorally and scanned, and you can see on DICOM files the radio-opaque markers. So we need to detect if the surface, intaglio surface of the complete denture is acceptable, because this will be the future surgical guide. In this case, no need to do any surface scan. We need to do 2 scans, 2 CBCTs. This is the CBCT of the denture with the radio-opaque markers. We're trying to do some cropping to make the surface better to do a matching. This is the CBCT with the complete denture of the patient, placed intraorally, and then we do the CBCT or the CT scan, defining the panoramic curve as usual. Then next step is scan alignment or scan matching or superimposition using radio-opaque markers. And then the implants will be placed prosthetically driven using the position of the denture. Okay, I will repeat one more time the process of the dual scan. In this case, we choose full edentulous, and then we have first the CBCT of the complete denture with the radio-opaque markers and the CBCT placed intraorally. We need to define the panoramic curve. Then what's very important is to match or superimpose between the 2 CT scans or DICOM files. Gingiva detection, then you can see the implant placed completely prosthetically driven. And in this case, because the surgical guide is supported by the mucosa, we need to add fixation pins to make it more stable. And here you can see the position of 5 implants placed prosthetically driven, or 6 implants and 3 fixation pins. This is a file that will be sent to a printer, and this is a drilling protocol, and this is the surgical guide printed using a 3D system printer. And then we need to place the sleeves. You have the T-sleeves for the implant placement and the sleeves for the fixation pins. In this case, it's very important to prepare a silicone index that will help by fixing the surgical guide in the same position as planned. Because if you have any movement of the surgical guide, the surgery will deviate completely from what we already planned. So what we do, we place the silicone index, we ask the patient to bite on it, then we fix the fixation pins. Then we remove the silicone index. We start by doing the punching because it's a flapless surgery. Then we remove the surgical guide. We remove the tissue that was punched already. Then we replace the surgical guide that on top of various bases. And you can see here the X-ray of 4 BLT implants with 2 regular tissue level implants posteriorly. And this is the photo of what we planned using the implant studio, and this is the X-ray, and you can see that they are similar. Three months later, after the healing, we will perform the hybrid prosthesis, and you can see here the full digital workflow, how we scan to perform this kind of prosthesis. So we start by scanning the temporary bridge, then emergence profile, then scan bodies. This is the lower, how we scan the lower, bite registration, we send it to the lab. This is how we superimpose using the dental system software between the scan bodies and the virtual scan bodies that he has it in the library. This is the design of the future bar to wrap it with pink resin and artificial teeth. You can see here the matching, the design. Then this is the temporary restoration. This is the bar sent to a SISMA SLM machine to print the metal. We tried it, we didn't have a perfect passive fit, so what we did, we cut, then we do soldering using pattern resin, low shrinkage resin, then we send it back to the lab, welding, retry it, we have a passive fit, then we finalize it with a hybrid prosthesis, and this is an occlusal view showing access hole completely in the palatal surface, occlusal surface, because the implant were placed prosthetically driven and with a full guided surgery approach. And this is the final result, and this is the case before and after. And I want to thank you very much for your attention, and I think this is a quote given by Alvin Toffler. It's very important to know that the illiterate of the 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. And thank you very much.